for Re-Cognition Health, and the purpose of setting up Re-Cognition Health was to provide a really comprehensive pathway for individuals presenting with cognitive problems, so that's really any difficulty with their thinking ability, in order to be able to get accurate diagnosis and early and most efficient and newest types of treatment. And in order to do that, I really brought together a group of cognitive experts. So these are neurologists, neuropsychologists, neuropsychiatrists, psychiatrists, as well as neuroradiologists, in order to provide the full team to make these difficult diagnoses. Is because many of the conditions which effectively involve both our brain and our mind require different types of expertise in order to both make a diagnosis but also manage the treatment and optimize outcome. So for example, the neurologists will be much more involved in the structural changes in the brain and the different ways in which the brain responds to disease processes, whereas the psychiatrists will be more involved in understanding the influences that those structural diseases have on the mind and how that is manifested in symptoms which are more of the mind than the brain, which I know is probably a little bit of a spectrum and difficult to differentiate. But I think people do understand that if we put it in categories such as, for example, a disease like multiple sclerosis or Alzheimer's disease or vascular disease, they actually affect our brain and body, but they also affect the way we think. The neuroradiologists are the diagnosticians to a large extent, so they will undertake more sophisticated tests to get objective evidence of an underlying disease process and also to provide a baseline from which to then assess the effectiveness of treatments. And then the neuropsychologists are more involved in undertaking cognitive tests and examinations to measure and understand both the type and extent of cognitive impairment that an individual may be suffering. I'm a neuroradiologist, so that's somebody who is heavily involved in diagnostic imaging and performing the right type of imaging in order to make a diagnosis for an individual's underlying condition. For clinical trials, these are big international clinical trials designed to bring new generation medications to the market to provide a new and obviously much more effective and efficient treatment for cognitive disorders. And particularly within that category, it's those diseases which cause progressive neurodegenerative change in the brain due to Alzheimer's, Lewy body disease, frontotemporal dementia, vascular disease. And this is a category of diseases for which over a long period of time there's really been a relative dearth of new medications coming to the market to change the course of disease and slow down progression of symptoms. The other conditions are something called Lewy body disease, frontotemporal dementia, Parkinson's, vascular disease, and then actually outside of cognitive disorders, we also soon will have a study for people who have really sort of quite difficult migraine to treat, people with depression, and then people who've got sort of like agitation and hallucinations. So there are a number of different studies that we're undertaking here at Re-Cognition Health. So there are a number of different conditions that can result in dementia, mild cognitive impairment progressing to dementia. Alzheimer's is the most common, and quite a lot is understood about what is actually happening in the brain that is resulting in the destruction of initially the cognitive brain cells, and then gradually more and more brain cells are affected, and that's why symptoms progress. There are two key proteins that there's quite a lot understood about. One is called amyloid protein, and one of the problems is as we get older there is an increased risk of overproduction of one of the fragments that come from the amyloid protein. It's called an A-beta amyloid fragment, And as that is abnormally overproduced, the brain is not able to clear it as quickly as it would do normally. And so therefore there's a build-up of this amyloid protein in the brain, and it becomes, if you like, a toxic amyloid protein. And that's one of the things that destroys the underlying cognitive brain cells. The other thing is a build-up of something called abnormal tau protein. And that not only destroys the brain cells, the cognitive brain cells, but it can also spread from one cognitive brain cell to another. And that's believed to be one of the reasons why symptoms of Alzheimer's disease really start to progress and eventually gather pace, because essentially the more of this abnormal tau protein you have, the more you get, because it's jumping from one brain cell to another. So the new style medications are designed to reduce the production of the toxic amyloid protein, increase the clearance of the toxic amyloid protein, reduce the activity of the abnormal tau protein within the brain cells, and reduce the ability for that abnormal tau protein to spread from one brain cell to another. There are also other mechanisms that are being employed with other new types of medications. There's an epigenetic medication which is designed to change the way in which the genome has been altered with respect to how it codes for the cognitive nerve. And if you can reset that back to the way it should normally behave, then it will dictate for the nerve to start behaving normally. So in other words, it'll sort of correct the underlying problem. There are other new medications that are based more on inflammatory processes. So there's a huge amount of research going on at the moment, probably more than almost any other field, because this is such a big socioeconomic problem, in order to try to get to a point where we can not only slow down further progression of symptoms once they've developed, but in fact actually identify people at risk of potentially developing cognitive symptoms and Alzheimer's, and to be able to bring in treatments at the point at which they're identified of being at risk, so that you're not just slowing down progression of existing symptoms, but you're actually pushing out the time at which cognitive symptoms might otherwise develop. With respect to Alzheimer's as the most common cause of dementia, one of the things that we were really determined to do when we set up Re-Cognition Health clinics was to ensure that we could give people who were presenting with cognitive symptoms with a possible diagnosis of Alzheimer's disease, firstly, an accurate diagnosis, and secondly, the opportunity to not only avail of treatments that are currently on the market, but also to avail of the opportunity to get early access to new generation medications, which are now getting close to the final phase of development. And really, if we're not able to do that, we're not offering people the very best in the world that is available to them. So clinical research really is unlocking the doors and providing the answers. It's about 15 years since the 15 years ago was the time that the last new medication came on the market for Alzheimer's. So if you think of all the other drugs that have come on the market for cancer and infection, etc. in the meantime, it really has been a long time in developing drugs for Alzheimer's. And one of the reasons for that is because it's a complex and difficult disease, and also it's difficult to diagnose early. They are designed to actually slow down the progression of disease and symptoms. So to explain that more clearly, the drugs that exist today for Alzheimer's disease are symptomatic. So what that means is the underlying disease process is such that the cognitive brain cells start to atrophy and die, and the way symptomatic treatments work is they essentially just help those brain cells that are dying to work more efficiently. However, the new type of medications are designed to actually stop or slow down the death of those brain cells in the first place. So they're treating the underlying disease process. So the opportunity today through clinical trials is to be able to get early access to these new medications that effectively are designed to try to change the future. And cognition, of course, it's a very broad term, and as I said, it's really just our sort of thinking ability. So it's not just, as often people think, it's not just memory. It's our what we call our visuospatial awareness. So it's our ability to navigate in a sort of familiar environment. It's calculation ability. It's what we call executive function. So it's planning. It's just all the things that the brain does naturally, that I say that we call our thinking ability. I think probably the best way to define our cognitive function or our cognitive ability is essentially just, it's our thinking ability. So it's all the things that we do every day automatically without thinking about it. So it's memory, it's calculation ability, or mathematical ability, it's planning ability, it's concentration, it's all the things that come under the category of executive function, so multitasking, prioritizing, making decisions, working out a complex strategy, managing financial, just difficult financial things. It's just essentially the best way I can try and describe it is all the things we do automatically as part of our thinking or intelligence. These components are all both interlinked, and an inability or a focal deficit in one may not necessarily manifest until you reach a tipping point when suddenly you start to realise that you're decompensating and you're unable to do things which we call activities of daily living. Suddenly you find that the things that you could normally do, you've lost sufficient specific capability in a significant number of these different components, that now the overall ability and overall thinking ability starts to become compromised. And then it starts to affect the way in which you can perform and the way in which you sort of generally sort of like function. But because that happens slowly usually, I mean, it's different if you have a car accident or something like that and you have a sudden functional deficit or cognitive deficit, then it's clearly very apparent. But in some of these neurodegenerative diseases such as Alzheimer's or Lewy body disease or vascular disease, this happens very, very slowly over a number of years. And so therefore you gradually start to adapt. And more importantly, the people around you, very often either your work colleagues or your partner will start to adapt. So gradually they start doing more and more things for you. And so often it only becomes apparent when that support for some reason disappears. The part of the brain which is involved in what we might call our higher senses. So it's obvious things like vision, hearing, sensation, and the other sort of big part is obviously our awareness of where we are in space, our thinking ability, the ability to be able to learn, retain and process information. All of that really is what goes on in our central nervous system and in our brain. Our memory is absolutely key because essentially our memory is who we are. So if we lose our memory, then we don't have any reference points. And that's why diseases such as Alzheimer's are so frightening really for people, because it doesn't affect the brain cells in the central nervous system that control our physical fitness, or at least certainly for quite some time, and our ability to walk around, run around and be completely normal. But what it does do is it quite specifically affects memory and thinking ability. So it effectively affects the essence of who we are. And everything that we do is reference to who we are, how we think about it, and our points of reference, which are all in our memory. And the ability to retain previous memories and create new memories. And that's recognition of people, places, events, everything. One of the really big misconceptions that a lot of people do have is that you reach maybe the age of 65, then you think, oh, better worry about my brain health. Actually, we have to be thinking about our brain health from, when we're very young. And it's actually exactly the same as our heart or anything else. And probably more importantly, because the brain is a more complex organism or organ. The things that we do on a daily basis that positively or negatively impact on brain health are effectively what we call our lifestyle. So the big things that have been identified as significant factors in terms of brain health are exercise, and there are now really big studies which have demonstrated statistically and scientifically that undertaking a certain level of exercise every week does have an impact on risk factors for diseases such as Alzheimer's, vascular disease affecting the brain. So exercise, diet, and I think again it's sort of like the same diet that's good for your heart is pretty much good for your brain as well. So in a nutshell, a sort of Mediterranean diet, fish oils, omega oil, etc. The other thing for the brain particularly is the brain is a muscle like any other muscle in the body, and it has to be well exercised. So from the outset, learning multiple languages, learning things like musical instruments, but just generally keeping the brain active, learning new things, being very sociable, all of this is just very good exercise for the brain. And then the other things really are just avoiding the things that are bad for us, which unfortunately is like avoiding too much alcohol or smoking, things which, again, pretty much like anything in excess, so too much of inappropriate sort of foods, cream and sweets and sweet things, etc. So it's avoiding the unhealthy things, which I think we all know what they are, and it's really just trying to focus in a sustainable way on the things which we actually generally feel better and keep us healthy. But there is now evidence that doing the right things in terms of exercise, diet, sleep is very important as well, having an appropriate amount of sleep and an appropriate amount of cognitive stimulation, if you like, can reduce risk factors for neurodegenerative cognitive diseases in the future by about sort of like a third, by about 33%. So there are significant modifiable risk factors which have been identified in big international scientific studies. Diet is really important for brain health and our general health. At a scientific level, it's important because of the constituents of the brain and the nutrients that the brain specifically needs. But at a macro level, the types of things which are important in the diet are to avoid those things which are bad, which we're aware of, so too much artificial sugar, fats, inappropriate fats, and then obviously too much alcohol, smoking. But the important thing is to focus on a healthy diet, which is really in this context defined as really a Mediterranean diet. So fish oils, nuts, pulses, sort of natural sugars, the right type of fats. I think people are increasingly recognising that sleep is very important for brain health. And actually often people do say that when you've got a stressful day or a difficult day the next day, sleep is actually your best weapon. There is now an increasing amount of evidence that sleep is important just in terms of regeneration of the brain, removal of potentially sort of toxic compounds from the brain that we create during the day. And although there's a huge amount about sleep that isn't fully understood, I think the really key message is that there is a significant appreciation now that sleep is much, much more important than we had realised previously. It's also to do with the quality of sleep. So some people might panic because they're not able to get enough hours sleep at night, but actually it's really important to just have a certain amount of sleep that will enable you to have the component of really good quality sleep during that time. That's not something we can regulate, it's just that's how the brain does actually work. So if you do have a limited number of hours that you're able to sleep because of your job or something like that, what will happen is you will have that good quality sleep in that period of time that you're able to sleep. But if you can't get a good night's sleep, then even frequent naps, like 20-minute naps during the day, are really excellent in terms of restorative influence on the brain. So whilst we don't understand it all completely, and I personally am not a sleep expert, but I think it is now just incredibly well recognised that sleep is very important for the brain. Stress is always one of those really difficult ones, because one person's stress is another person's minor stimulation. So I think the thing is, I think everybody recognises that a certain degree of stress is actually very good for us, and it's often what motivates us, etc. So there is definitely a healthy level of stress. However, when stress starts to become unhealthy and starts to create anxiety and reduction in our cognitive performance, then that's when stress is bad. And the real problem with stress is that it can get into a vicious circle. So the more stressed you become, the more anxious you become, the less well you perform, so therefore the more stressful you become. From the word go, we should be working on our brain health, so optimising and protecting our brain, and that's diet, exercise, sleep, and being as mentally active as we possibly can, so exercising our brain like any other muscle in the body. We then need to be, and this is more as we get older, we need to be very proactive about identifying very early symptoms, so like with any disease, presenting early, and obviously having knowledge and going to the right place and getting an accurate diagnosis gives us the ability to be able to act in a way that will open more doors, give individuals more choice. Once somebody has potentially developed symptoms of progressive neurodegenerative change or cognitive change due to a condition such as Alzheimer's, it really is important to run, don't walk if you get a diagnosis. The earlier you know, and the more you know in terms of where you can get access to not just the treatments that are available local to you from your local doctor, but the treatments which are available on a global scale. So these are internationally available treatments which can be accessed through specialist centres, such as our Re-Cognition Health centres. Then you can have the opportunity to get early access to new generation medications designed to slow progression of disease, in addition to being able to take the medications that are currently available on the market, the symptomatic treatments. And then the most important thing, again, comes back to knowledge. So if you know what's going on and you can prepare and educate, you can maintain your independence for much longer. So it's really, if you talk to people who do have symptoms of progressive memory loss and other symptoms of cognitive impairment, often the most important thing is they want to be able to maintain their independence for as long as possible. So the earlier you're diagnosed, the more chance you've got of being able to do that, both in terms of getting early access to these new generation treatments, but also in terms of making decisions, putting coping mechanisms in place. And there are lots and lots of things now which are available, which are designed specifically to help and increase the ability and time during which you can maintain your independence.